We know that keeping your family healthy is always your first priority, so I want to take this moment to discuss a serious issue. I'm talking about the warning signs of a stroke. It's the third leading cause of death in the U.S. And joining us is Dr. Frieda Lewis-Hall, the Chief Medical Officer of Pfizer. She leads a team of thousands of medical professionals who collect and share health and medical data. But she's here today to discuss important health topics, and today we're going to be talking about strokes. Welcome to the show.
Oh, well, thank you for having me. I appreciate it.
And we've talked about strokes on our show before, but I don't think people realize how debilitating and how deadly they can be.
Well, strokes are obviously very debilitating, but they can also lead to death, and a lot of people forget that. My mother died of a stroke the summer of my freshman year of medical school, and that really cemented for me the importance of education and prevention around stroke. Now, I'm the Chief Medical Officer at work, but I, like most of your viewers, are the chief medical officers at home. So having important life-saving information is really job one.
And everyone needs to know exactly what to do when a stroke occurs, but the question is, what happens when someone has a stroke? What's going on in the brain? So I'm going to show everyone really quickly on our magic wall. There are two different types of stroke, but the end result is the same. Brain dies. And a very common form is called an ischemic stroke. Very often it occurs when a blood clot in one of the arteries, it can start anywhere between the heart and the brain, this blood clot can form. It'll travel up to the brain, and whatever blood vessel is cut off by that clot, beyond it, brain can die. Hemorrhagic stroke occurs when a blood vessel in one of the arteries leading to the brain or in the brain bursts, as you see here. So what happens beyond that? There's no blood flow. So whether it's a clot or a hemorrhage, whatever area beyond that where the stroke occurs, that brain will die. And that, of course, the symptoms of a stroke depend upon what area of the brain is injured.
But that is exactly why it's important for people to know the warning signs and to seek medical treatment right away. There's a FAST acronym that helps people really remember both the signs and what to do about them. FAST, F-A-S-T. The first is face. Ask the person to smile and see if a part of their face is drooping. The second is A, for arm. Ask them to raise their arms, and if one of their arms seems weak or drifts. The third is S, for speech. Ask them to repeat a simple sentence and see if their speech is slurred or confused. And last is T, for time, and time is critical. Dial 911 right away. So we want people to act fast, but we also want them to remain calm, because we want them to be able to provide important information to the emergency room doctor, like when did these symptoms start? Are there current medications? Are there allergies or other medical conditions?
You also need to know if you're at risk or your loved one is at risk. Your risk of stroke doubles for each decade of life after the age of 55. It's also greater when a parent, grandparent, sister, even brother has had a stroke. And although strokes are generally more common in men, more women actually die from them. So if you've suffered from a mini stroke, it's called a TIA, transient ischemic attack, you're 10 times more likely to have another. And they can certainly lead to physical, mental impairments, and as we talked about before, even death.
But you can cut your risk of having a stroke by managing the controllable risk factors. First, if you smoke, don't. The nicotine and carbon monoxide actually injures the cardiovascular system and increases the risk for stroke. Women who take oral contraceptives and smoke really greatly increase their risk. The other is monitor your blood pressure. High blood pressure is the most significant risk factor for stroke and the most important controllable one. And obesity is also a risk factor.
And these are modifiable. You can do things like reducing your blood pressure and your risk of obesity by maintaining a healthy weight. Get active. Do things that you enjoy. It doesn't have to be exercise. And watch your salt intake. Fruits and vegetables, low-fat dairy foods. If you do drink alcohol, make sure you do that in moderation.
Now, we have more information and resources on my website, but if there's one thing I want people to take away today, it is this, that a stroke can be as deadly as a heart attack. So know the signs and act fast.
FAST, if you remember nothing else. Thank you so much for being here today.
Thank you.